Greetings, audience. Hi, I'm Stephen Zhang from the First Affiliate Hospital of Nanjing Medical University, and we have Professor Cindy Li, also from the First Affiliate Hospital of Nanjing Medical University. So we are very happy to participate in the ESC Congress to present our QUEST study result. So I will let Professor Li to introduce the rationale and the objective of our study first.
So I'm very glad to and got honored to present our and briefly introduce our clinical study, HFrEF, heart failure study. So this is a clinical study funded by our government. Why our government funded this study? Because the traditional Chinese medicine, for cardiovascular disease over 1,000 years history. According to our previous study, we published this paper in 2013 in JCC. We found antibiotic reduced 30% in Qiliqiangxin group versus the placebo group. Our government asked us, this is only short period of study, ask how about the long term for HFrEF patients can relieve or maybe reduce the cardiovascular death or heart failure rehospitalization to solve this the key issue or key problem. That is why our government asked us, funded us for this study. We design the QUEST study and the beginning for over 3,190 cases for this study. And that's all.
I will comment on some of the rationale and objective. So our treatment, so Qiliqiangxin, was compared with the placebo, and then on top of the standard heart failure treatment, medication treatment, and then so we are very thrilled to have a positive result. And while the main outcome, so the cardiovascular death and mortality was significantly reduced by 22% in Qiliqiangxin group. And then for the component of the primary endpoint, the cardiovascular death was decreased by 17%, and the heart failure hospitalization was reduced by 26%.
Yes.
Well, also we have some subgroup analysis showing that some of them it's unpublished yet. So we presented some of the key subgroup analysis showing that between the use of RNA, the use of the RAS, beta blocker, and MRA treatment, and also the ischemic and non-ischemic etiology, the main result was generally consist between the subgroup. So it's very happy to see the results. It's positive, and also to be mentioned, the safety endpoint. There is no significant difference between the adverse endpoint, and the serious adverse outcome between the groups. The next part, I will let Professor Li to further introduce the clinical impacts and future direction of the start from our result from now.
Yes, as we know, the heart failure main etiology, especially Western countries, ischemic heart disease, the most of patients, their main etiology for heart failure. According to our clinical trial QUEST study, we enroll 70% of the patients who were the main etiology ischemic heart disease. This study finally we got a positive result, which means in later we can maybe, and from China, we can maybe benefit for ischemic heart disease, the patients' medication improve the prognosis, and could be in the future we can maybe and communicate and and give the Western countries, the professor, doctors, and let them know the benefit from the traditional Chinese medicine, Qiliqiangxin, could be in the future for the Western country, heart failure patients, because most of them, the majority of patients heart failure etiology also similar to China. Their ischemic heart disease. So I'm sure in the future, more benefit for all over the world and heart failure patients due to the ischemic heart disease. We just waiting for the good news coming, Thank you.
So for the data compared to other comparable trials, in our hotline section 2, Professor Caroline Lam did do a very good job to summarize some of the DAPA heart failure trials and to compare some of the baseline with ours. So our trial have a bit more is patient with ischemic etiology, and also the overall the baseline characteristic it's generally consists comparable to the DAPA heart failure. So we are very thrilled to have a validation from the ESC community to our trials.
And at present, even this ESC meeting, so the new heart failure guideline just announced, so regarding the heart failure. So regarding the medical treatment, drug therapy, and totally, and according to GDMT study, so like the ANI, or maybe ACR, or maybe ARB, plus the beta blocker, plus the MRA, plus the SGLT2. This is the standard therapy for
the four-pillar
for HFrEF patients, similar to our clinical study, HFrEF patients. Yes, sorry about that. So according to paradigm heart failure study, mainly involving study the Entrustol, and the DAPA heart failure also use the SGLT2, the medication for and improve the HFrEF patients. Our study, we found all of the major and primary heart endpoint, reduce the mass similar to our just now the international heart failure guideline recommendation therapy. So I think in the future we could be next steps. We want to compare, maybe use the traditional Chinese medicine, maybe plus or maybe isolated in my country, compare and see how it's going on. It's better combination therapy, or maybe isolated traditional Chinese medicine and Western medicine is which one, which method is best one for the heart failure patients. This is, I think, at present time, our clinical study design is similar to all of the international HFrEF study, similar. In criteria and exclusion and inclusive and criteria the same.
So let me conclude a bit. So we wanted to using all evidence-based medicine method to translate the traditional medicine to a modern medicine aspect. We do anticipate that the traditional medicine have a lot of treasure, a lot of things that can have clinical benefit for us to dive into. So hopefully in the near future, more clinicians can join us into founding this treasure out of the traditional medicine. So thank you.